HMSA and Island Scene writer David Frickman suffered a stroke about 9 months before this interview.
My wife called 911 and an ambulance came, and how much of a difference does it make?
Yeah, it definitely makes a difference. I see all the time people opt to not call 911, and you always run the risk of not being triaged appropriately. So say you have mild stroke symptoms and you try to go through triage and maybe you don't hit the emergency room and get seen immediately by a neurology person. Time is brain, so we like to be as quick as possible.
That quick response gave David access to life-saving treatment.
You had an ischemic stroke, which is a blockage of blood flow to your brain. And what that does, it kind of provides blood flow to a lot of the big area that can leave you permanently disabled.
Anytime we talk about stroke, we got to talk about the signs of stroke and help people know those.
Queens recommends looking at BFAST. So balance, eyes, face, arms, speech, and time. So if you notice someone's acutely off balance when they're walking, kind of uncoordinated, that's a stroke sign. Eyes, so are your eyes facing one way or the other? Any blind spots in your eyes, that can also be a sign of stroke. So is there any facial drooping? So one side of the face would be drooping, and then arms. So have them hold their arms up. If you're having stroke, possible that one of your arms may drift down your weaker side. Speech, so is there speech difficulties? Whether that is slurred speech or whether that is unable to speak or unable to understand. And then time, just again, meaning time is brain. For every minute that we don't restore blood flow to the brain can leave damage.
Thanks to timely care, David made it through, and he hasn't forgotten those who helped him get there.
I got to thank you for what you've done.
Yeah.
I appreciate it.
Everyone here at Queens and within the neuroscience department and the ER nurses who never see their patients again, how cool to see that now he's doing this interview and he's doing so well.